Hello friends, welcome back in the channel of Clinical Care Insight. We started a series of lecture on reproductive system, okay? Until now we discussed about the overview of reproductive systems. We deal with separately the male reproductive system, female reproductive systems. Then we also understood the functions which is operating by this system, that's called reproductive systems. We see in the spermatogenesis, we see in the oogenesis, and after the oogenesis we also see in the menstrual cycle in details. We have the detailed lecture over the menstrual cycle. Then we seen the fusion between these two gametes, the sperm and the egg, okay? Then we seen about how zygote undergo the successive cleavage or division and form you can say one multicellular structure, 64 cell structure that's called the blastula, and how blastula get attached to the endometrial lining of the uterus, that's called the implantation. Till now you have any doubt? No, if you have any doubt then comment down. We will love to answer your queries, answers your doubt. Now in today's lectures we will discuss about mainly the pregnancy, okay? We will deal with the pregnancy, and here is today's lecture outline. First we will deal with the introduction. Then we will understand the meaning of gestations, the time duration of the gestations, okay, and the problems, some common problems related with the gestation. Then we will deal with the fetal environment and the maternal environment, okay. This fetal environment, we will have the separate lectures on the fetal environment later, but in today's lectures I am going to mainly emphasize about the changes which is occurring in the maternal environment, okay. What changes? Like structural changes, metabolic changes and physiological changes, okay. So make the heading. I hope you all are fine. Well, I'm also fine. Now just write today's first heading about the gestation. See, the gestation is a time period. Gestation is the time period, or it is referred to the time period of pregnancy. So gestation is also called as pregnancy. Write it down. Gestation is also called as pregnancy. Okay? And this reproductive event, okay, their duration is average measured, okay, 40 weeks, or you can say 280 days, okay. It's an average duration. But if there will be a, you can say, the ovulation on the 14th day and the overall menstrual cycle is about the 20th day, then the actual pregnancy date, we can calculate by subtracting the average days of pregnancy, okay, minus the ovulation day. That comes approx 260. Yeah, it's a 260, isn't it? 280 minus 270 and 4. No, it's 266 days. Okay, 266 days. It's a actual pregnancy date. If the criteria is, if the, you can say, the menstrual cycle length is 28 days, okay, and if the egg fertilized on 14th day, okay, then the actual pregnancy will be on the, yeah, the actual pregnancy, you can say, period is 266 days. 266 days. Now traditionally pregnancy time period is measured in the 10 lunar month. Got the point? Once again, we are defining the gestation. Gestation means, gestation is referred as the period of pregnancy is called as the gestation. Okay, the average, you can say, duration of this pregnancy or gestation is 280 days. Okay, from last menstrual period. From the last menstrual period, it is measured as a 40 weeks or 280 days. But if the menstrual cycle is about the 28 days and the ovum is lucky enough, egg is lucky enough to fertilize on the 14th day, then we can measure the actual pregnancy average durations minus the, you can say, the ovulation period. That's 280 days minus 14, and outcome is 266 days. Understood? Then in humans, the modern calendar says it's a 9 month and 7 days, plus minus 7 days, and traditionally it is in a 10 lunar month. It is in a 10 lunar month. Okay, now if unfortunately the pregnancy terminate before 28th week, it is called as miscarriage. It is called as the miscarriage. Okay, if the pregnancy will terminate before the 28th week, it is referred as a miscarriage. Understood? And if the pregnancy terminate, okay, before 37, isn't it? Yeah, 37th week, it is referred as premature labor. Premature labor. Fine, no problem. And there is one more terminology called as the stillbirth. A stillbirth refers to the death of a fetus in the womb after 20 weeks. Okay, after 20 weeks, if the pregnancy will terminate, okay, after 20th week, it is referred as a stillbirth. It is referred as a stillbirth, because this terminology you came across in textbook, okay, and during your clinical exposure you will come across this term. The first term is if the pregnancy terminate before the 28th week, it is referred as a miscarriage. Got the point? Then if the pregnancy will terminate before the 37th week, it is referred as a premature labor. Got it? And now if the pregnancy terminate after the 20th week and the child is, you can say, found with death, and it is called as the stillbirth. Fine, no problem. Now once you understood about the gestation, the meaning of pregnancy, let's move ahead and discuss about the changes. Because the one thing you should keep in your mind, that when the normal female, okay, and the normal female, she become the pregnant, then there is a profound, you can say, changes occurring in their whole body. Okay, starting from their reproductive environment to their physiological system, okay, to their also the metabolic system. The metabolic changes also happens in the pregnant woman. Okay, and if you talked about that why this happened, then just keep in mind that these all changes help a woman, help a pregnant woman to, you can say, give birth a young healthy child. In order to give a young healthy child, okay, these changes is necessary. These changes is necessary. Okay, so all those changes, write it down, all those changes is, you can say, beneficial, but if there will be a severe fluctuation, okay, if there will be a severe changes and that is not managed, you can say, clinically, then that changes can lead to the, you can say, death of a child and even the death of the mother. Okay, so the management okay is, you can say, the very important. It's a very important. Got the point? No problem. Now let's move ahead and see what changes is occurring, what kind of the changes is occurring during the gestation time period. So first I am going to highlight about the fetal environment, and then I will move ahead and discuss the maternal changes. So the fetal environment. Fetal environment. Today is World's Mother Day, so happy Mother's Day to all. So it's a fetal environment. Fetal environment denotes the environment where the fetus is, you can say, developing, growing. Okay, and you know that environment is the maternal environment. Fine, that environment is a maternal environment. And remember, the growth, okay, development and, you can say, the natural birth, okay, natural birth, all directly depends upon the maternal environment. Maternal environment. Fine, no problem, because this is the environment. We also refer this maternal environment as a, yeah, it is also referred as an intrauterine environment. It is also referred as a intrauterine environment, because this is the environment where the child is growing, the child is developing. Okay, and if there will be any abnormality, if there will be any insufficiency, or you can say the deficiency in the intrauterine environment, okay, which is then that, you can say, strongly influence the child growth, the child development, and the, you can say, the birth, natural birth. It can be, you can say, the premature birth. Fine, if the maternal environment is not, you can say, supportive enough, then there will be a premature birth. And we will see, when we will discuss the fetal environment, we will see about the amniotic fluid, the amniotic sac. Okay, we will also see about those placenta, okay, and the umbilical cord, fate of umbilical cord. We will also see about some of the tests. Okay, and you will surprised to know that if there will be a, you can say, the early diagnosis, or you can say the early detection of the fetal environment, of the fetal, you can say, fluid, of the fetal, you can say, the genetics, then there is a higher chances to prevent the chromosomal disorders, as well as the premature birth. We will see the disease regarding the disturbance in the fetal environment. So why I am describing the maternal environment first, now you got it, just because it is depend upon the maternal environment. Okay, so now let's move ahead and discuss the maternal changes during the pregnancy. maternal environment changes. So in the maternal environment changes, there is a series of changes. Fine, there is a series of changes in the maternal environment. So we will first deal with the structural changes. Okay, first which we are going to discuss is the structural changes. Structural changes. What do you think? The reproductive part of a you can say pregnant woman is same as we compare to the pregnant woman? Is it same? No, it's not same. Okay, it's not same. There is a, you can say, the very big change in between if we compare the normal woman and the pregnant woman. So the first change is the structural change, and this structural change is both in the primary and the secondary sex organ. Both in the primary, okay, sex organ as well as in the secondary sex organ. So let's start with the primary sex organ first. The primary sex organ in the case of female is very good. It's a ovary. Okay. So first we will see that what changes is occurring in the ovary. Normally you know, okay, normally you know that in the non-pregnant woman, the ovary undergo the cyclic changes, isn't it? We seen, okay, we seen while we are describing the menstrual cycle, we seen that ovary undergoes the cyclic changes, okay, and these cyclic changes is constant. This cyclic changes is constant until a woman becomes the pregnant, a female become the pregnant. Then only there will be a, you can say, a cessation. There is a stoppage in the follicular changes. So during the pregnancy time, okay, the follicular changes is stopped. Follicular changes is stopped, or you can say the cease. Fine, and that explain why during the pregnancy time female don't have the menstrual cycle. This follicular changes stop because of the two reasons. There will be a negative feedback mechanism which we've seen already. Negative feedback mechanism. Okay, this mechanism is, you can say, mediated by the two hormones, okay, that is your estrogen and progesterone. These hormones, they send a signal to the hypothalamus that stop the secretion of FSH and LH, and due to the deficiency, or you can say the lack of FSH and LHs, female follicular cells do not, you can say, undergo the proliferation, okay, result into the no menstruation, That's the one way. The second, you can say, the changes in the which you can say the occurring in the ovary during the pregnancy time is the changes in the hormone pattern. Now in the ovary there is a secretion of FSH and there is a secretion of the estrogen and progesterone. Now remember, we discussed about the one, you can say, part of female reproductive system, you can say one structure of the reproductive systems. I'm just giving you insight, and I want to know the name of those structure, and that is also called as the temporary endocrine gland. Yeah, very good. It's your corpus luteum. luteum. Now this corpus luteum during the pregnancy time, see the normal lifespan of corpus luteum is 10 to 12 days, about 10 to 12 days, okay, and after that it will degenerate, okay. But if the pregnancy happen, then there will be a, you can say, one intracellular signals goes to the corpus luteum, and corpus luteum, you can say, start over, you can say, functioning till the first trimester, till the 3 month, okay. And this changes is only happening during the pregnancy. So this corpus luteum, it will change into their you can say more functional state, and that is called as the corpus gravidum. Write it down, it can be asked in the MCQ. Corpus gravidum, okay. And it secrete the high amount of, this corpus gravidum is secrete the high amount of progesterone, okay, progesterone in a high amount. Along with it also secrete little estrogen. It also secrete the little estrogen, okay, in little amount. And these hormones that in turn work on the different part of the reproductive systems and make them, you can say, very cooperational with the developing fetus, to supporting the developing fetus. Now these are the two changes which is happening in the ovary during the gestation time, or you can say the pregnancy time. Okay, this corpus luteum enlargement that lead to the corpus gravidum, it have the very important, you can say, clinical significance. If it will degenerate sooner, then there is then that lead to the abortion. That lead to the abortion. So the lifespan of corpus luteum is very important as far as the gestation or pregnancy is concerned. No problem. Now, once we discuss about the ovary, now let's come to the secondary sex organ. Secondary sex organ, the first is your uterus. Okay, it's a uterus. Uterus mainly undergo the changes in their shape. It undergo the changes in the shape. Fine. It undergo the changes in the size. Okay. It undergo changes in the weight and histology. Weight and histology. Okay. So normal uterus shape, okay, normal, you can say, the uterus shape and size shape is a pyriform, isn't it? The normal shape of the uterus is the pyriform, but during the pregnancy time it changed into the globular form. Okay, it changed into the globular form. If we talked about the size, then there will be three things. First, you write down about the shape. Normal shape is pyriform. So pyriform shape changed into the globular shape. Fine. If we talk about their size changes, then there will be three things. First one is a hyperplasia. Okay, then there will be a hypertrophy, and size also changes due to the fetal growth. Now what I mean by the hyperplasia denotes the increase, okay, in the number of cells of endometrium. Okay, endometrium undergo you can say proliferation under the effect of estrogen and progesterone, which we will see during the you can say implantation time. So this hyperplasia term denotes increase, okay, increase in the cell number of, very good, myometrium. Not endometrium, it's a myometrium. Fine. Then there will be hypertrophy, means increase in the growth, okay, increase in the growth of myometrium, increase in the growth of myometrium. Fine, no problem. Now if we talk about the weight, then you can say the normal weight of the uterus is about 30 to 50 gram. It's about the 30 to 50 gram, but it changes to 100 to 1200 gram. Okay, it changes to the 1000 to 1200 grams. It's a profound change. Fine. And if we talked about the histology, then the layers, okay, the layers of the endometrium, it undergoes changes. The decidua layer which we seen, okay, decidua layer where the implantations, you can say, happened, when the implantation is, you can say, performed, those, you can say, there will be a changes, there will be a changes. Once again, let's summarize it again. During the, you can say, pregnancy times, uterus undergo mainly the changes in their shape, their size, their weight, and their histology. If we talked about what changes occur in the shape, then the normal pyriform structure, it will change into the globular structure. Okay, and if we talked about the size, then there will be a hyperplasia of myometrium, very good, hypertrophy of myometrium, and there will be a fetal growth. All three things lead to the increase in the size of the uterus. Then there will be a weight changes. Okay, the normal 30 to 50 grams weight changes to the 1000 to 12,000 gram weight. Okay, and if we talked about the histology, then mainly the decidua, the bed for the fertilized ovum is, you can say, undergo the changes. Now once we deal with the ovary, uterus, let's move ahead and discuss about the vagina. Okay, I am here only going to describe about the vagina. See, the vagina mainly undergo the changes in their coloration. Okay, the color of vagina is changed, coloration is become brown. Why it's become brown? Due to the good supply of blood, or you can say the high supply of blood. Fine, that's about the vagina. And this tough, you can say, vagina, fine, this tough vagina, it you can say acquires some of the glycogen in the epithelium. Okay, it acquires some of the glycogen deposition in the epithelial lining of vagina. Okay, and this all contribute to increase in size too. So size of the vagina, it's also increases. Size of the vagina, it's also increases. Now once we talked about the ovary, uterus, vagina, let's move ahead and discuss about the cervix. Yeah, the changes in the cervix. See, the changes in the cervix is mainly, you can say, the glands. You know that normally there is a presence of gland in the cervix, and those glands undergo the changes. Okay, and they become more, you can say, the more glands are developed. Okay, and that is necessary, and there will be a mucus plugging. Okay, there will be a mucus plugging in cervix. Okay, so mucus plugging. Fine, no problem. Hand by hand also here talked about the fallopian tube. You know the fallopian tube is one tubular structure. Okay, and in the fallopian tube mainly the number of epithelial cell and the blood supply is increased. Okay, number of epithelial cell and blood supply is increased. So if we talk about the fallopian tube, then there will be a, you can say the increment or increase the cell number and size. Fine. These all changes are, you can say, not observable outwardly. It's not observable outwardly. Some of the changes like the cervical changes, okay, these things, the vaginal changes, this can be observed. But the main changes which is observed during the, you can say, pregnancy is the mammary gland. Mammary gland undergo the, you can say, the profound change, okay, a large change under the influence of progesterone and one more hormone which is secreted during the pregnancy called as the prolactin. Okay, prolactin. These all changes, okay, if we talked about their changes, then there will be a, you can say, the formation of the mammary ducts. Mammary ducts. There will be a enlargement in the size of the breast, due to the, very good, fat deposition. Okay, then there will be a changes in the color of nipple. Okay, color of nipple changes. So these all are the, you can say, the preparation. These all are the preparatory for the, you can say, the breastfeeding. These all changes are necessary. So once again, let's summarize it. What we understood that during the pregnancy, or we can say the gestations, the maternal environment undergo the changes, okay, and all these changes lead to the overall, you can say, the development of the developing child, of the developing fetus. Okay, the first change, if we talked about, then it is a structural changes. Okay, and these structural changes occurs in the both the sex organ and in the primary sex organ and in the secondary sex organ. If we talked about the primary sex organ, in the case of female, it is the ovary undergo the two changes. First, the usual, you can say, the cyclic follicular changes will stop, okay, due to the estrogen and progesterone, which give the negative feedback mechanism to the hypothalamus that stop the secretion of FSH and LH. Then there will be a changes in the corpus luteum, okay, a structure which is, you can say, formed after the ovulation. It undergo the enlargement and form one, you can say, enlarged structure that called as the corpus gravidum, and this corpus gravidum, it secrete more, you can say, amount of the progesterone and little amount of the estrogen. Okay, and the clinical significance related with the corpus luteum is that if it will degenerate sooner, then that lead to the abortion. Now if we talk about the uterus or secondary sex organs, then uterus undergo these changes. The first, the shape changes, then the size changes, then the weight changes, and the histological changes. The shape is the normal, you can say, the female, or you can say the non-pregnant female shape of the uterus is a pyriform, but during the pregnancy time it changed into the globular form. Okay, then if we talked about their size, it undergo the three changes: the hyperplasia, that is increase in the cell number of myometrium, then it undergo the hypertrophy, increase in the growth of myometrium, and the fetal growth. Okay, understood. Now come to the weight. The normal weight of the uterus is 30 to 50 gram, but during the pregnancy the weight becomes 1000 to the 1200 grams. If we talked about the histology, the bed of the implantation, the bed for the implantation, that is the decidua, it undergo the changes. It basically differentiate into the three layer. Okay, if you want, write down the name. The first is called the decidua bassalis, okay, which is a maternal part. Then decidua capsularis, that's around the fetus, developing fetus, and decidua paritalis, that line the rest of the uterus. Okay, now if we talk about the changes occurring in the vagina, then mainly in the vagina there is a changes in the color, vaginal normal colors, you can say the normal pink colors become brown due to the more supply or good supply of the blood. Then there will be also a glycogen deposition on the epithelial lining. Then if we talked about the size, then vaginal size also increases. Now come to the cervix. In the cervix there will be a glands, and that glands becomes they over proliferate, that is necessary, and there will be a mucus plugging that prevent the leakage. Now come to the fallopian tube. In the fallopian tube, there is an increase in the cell number and size. If we talked about the mammary gland, the main observable changes, okay, that is in mammary gland, and mammary gland mainly changes. There will be a, you can say, more formation of alveolar duct or mammary duct. There is a deposition of the fat that lead to the you can say the enlargement of the breast, and there is a changes of the nipple color. So these all are called as the structural changes, okay, during the pregnancy. Now let's come and discuss about the metabolic